Neurology, pathology, neonatal intraventricular hemorrhage. All right, so this is just gonna be a really quick video. This is just when you have hemorrhaging in the neonate within the ventricles of the brain. Okay, so it's bleeding within the ventricles. What they want you to know, and they're going to ask you a million times over and over and over and over, where does it originate from? The bleeding originates in the germinal matrix. Okay, it's a highly vascular area within the neonatal brain, and that is usually where the bleeding is coming from. It's the germinal matrix. Do not miss that question. They're going to ask you it. Okay. The reason it occurs is because they don't have that well of glial support, because once again, they could be premature. Premature and low birth weight infants are usually at the highest risk of this, okay? And so what they need to do to visualize it is that they'll do ultrasonography, and they'll show you a photo of an ultrasound of the baby's brain, okay? Whenever you see something lighting up within the ventricles, start thinking about the neonatal intraventricular hemorrhage, okay? Because I used to miss that. I used to be confused as to what they were showing me, but if there's blood within the ventricles, you know that it's a neonatal intraventricular hemorrhage, okay? So the risk factors, once again, is going to be prematurity. So any baby that's born less than, honestly, any baby that's born less than 38 weeks, but like severe prematurity is high risk for neonatal intraventricular hemorrhage. So any baby that's born less than 32 weeks, it should be on your radar. And any baby that's born very skinny, low birth weight, less than 3 pounds, 5 ounces, it should be on your radar. Okay, so these are trigger things that should be like, oh my gosh, if I see a baby that's born at less than 32 weeks or less than 3 pounds, 5 ounces, and they're starting to have a lot of symptoms like altered level of consciousness, bulging fontanelle, if they have like seizures, coma, hypotension, right? These are symptoms of neonatal intraventricular hemorrhage. And then they might show you a photo on ultrasound that lights up within the ventricles. Start thinking about neonatal intraventricular hemorrhage and the fact that it originates in the germinal matrix. Okay.